I'm Dr. Sue Ishaq, newly minted Assistant Professor of Animal and Veterinary Sciences at the University of Maine, and today I'll be talking about framing the discussion of microorganisms as a facet of social equity in human health. So I'd like to talk to you about the concept of microbes and social equity. If you're wondering what that actually means, and if it's perhaps just a non sequitur, you're not alone. A little over a year ago, I started talking about microbes and social equity, and today I want to share that journey with you. First, let's define social equity. Equality would mean we all get the same public resources, and it really depends on everything else being equal. But we all know that humans aren't perfect, and our societies are not equal for intentional and unintentional reasons. Social equity is the process of ensuring fair access to resources and assumes that we aren't all starting with the same advantages. Some people might need a little extra help to access the same public resources. When I talk about access to public resources, there are many examples to choose from, but I'm going to focus today on food and nutrition, shelter and safe housing, and healthcare, which is particularly relevant these past few months. I am focusing on these three factors because they are near and dear to my researcher heart, but also because they are well documented to affect our exposure to microbes in our day-to-day life. The important thing to remember, though, is that not all microbes are bad. So when I say exposure to microbes, I am thinking about both the positive and negative examples of that. Let's start with diet. The specific nutrient profiles in food will select for different microbes. For example, proteins differ wildly in their amino acid building blocks. While animal protein contains the amino acids we need to live, it also encourages the growth of some bacteria which can contribute to certain systemic health problems. This isn't to say that we should all give up animal protein. I was eating bacon as I was making this presentation, but the motto, everything in moderation, is a good one to keep in mind. The problem is, fast food is easy to get anywhere at any time, and because it's really cheap, it might be your only option sometimes. Most fast food is high in animal protein and saturated fats, but low in fiber and anything resembling a vegetable. Probably the most important component of your diet, though, are plant fibers, especially from fruits and vegetables. There are a handful of different kinds of fiber, but they are all large molecules that make up the structure of that plant. Humans and animals don't make the enzymes required to digest most plant fibers, but some microbes do. These microbes ferment the fiber in your diet and produce a lot of byproducts, some of which are volatile fatty acids. Volatile fatty acids are well demonstrated to improve your health in different ways, and especially promote a healthy digestive tract. The amount and diversity of fiber you eat is important, but consuming it regularly is also critical to being able to encourage those fibrolytic microbes that benefit you. They are really fussy about what they eat, and if you don't feed them, they'll die off. The problem is trying to access foods that make up a healthy diet. A food desert is a place where traveling to buy food is onerous, or there simply isn't food available. In urban settings, this is often defined as a distance of more than a mile to get food. This might not seem like a lot, but try it when you are juggling a stroller, a physical disability, or a heat wave, and you might feel differently. In rural settings, the distance is 10 miles. It might seem like food deserts are a remote issue, but they are closer than you think. This is a map using data from 2015 on the USDA Food Atlas. Maine, where I am now, is rural in all but two areas in the south. That red square is where I am, nestled between the city of Bangor and the college town of Orono. I'm not considered to be in a food desert because I am only 7 miles from a grocery store. But I have one car that I share with my partner, am 6 miles from the nearest bus stop, and biking to town from where I am is not a safe option. I'm one mishap away from being unable to access food without paying a premium for delivery services. Next up, location. We know that building quality can affect our health in terms of chemical or microbial exposure, which occurs in a few different ways, but more or less causes damage to our cells that make it easier for microbes to get past our cell barriers. Remember, we want to associate with microbes, but only on our surfaces and not inside our actual tissue. Our location with respect to city planning can determine our chemical and microbial exposure. We know that air pollution causes a number of different health problems and contributes to mortality. Infectious microbes can be carried in the air, but mostly we are concerned with the damage that those chemicals cause to our cells that make us susceptible to infection. City zoning is intended to protect occupants from hazardous exposure from manufacturing and industry, but as cities become more dense, residential areas move closer to industrial areas. Not all residential though, only low income. This map shows Birmingham, Alabama in 2018, with the map colored by median income. The red shows very low income, as well as low and moderately low in orange and yellow. High income is in purple. The yellow map markers show pollution emission sites, and you'll notice that almost all of these are in low income areas. It's not just that low income residential areas are starting to push up against existing industrial areas, but studies show that new industrial sites are placed into low income residential areas because occupants lack the social capital to argue against that. If you work 2 or 3 minimum wage jobs just to live paycheck to paycheck, you typically don't have time to attend city council zoning meetings. Finally, healthcare. When we are healthy, our immune system can maintain a balance with our microbes and keep them in check. Preventative healthcare is really well demonstrated to keep us healthy and prevent complicated, expensive, and potentially life-threatening medical conditions later on. Many medical conditions are associated with having a disordered microbial community, and whether these disordered microbes are the cause or the effect, they can still exacerbate negative symptoms. In particular, perinatal and dental care are really important to general health and maintaining beneficial microbes. Another aspect of microbes and social equity that is really topical right now is access to preventative measures to help us avoid microbes. COVID-19 has changed the way our society understands infectious disease and public health policy. Paid sick leave, permission to work remotely, personal protective equipment supplied by your workplace, and respect for employee health are all demonstrated to reduce disease transmission. But not everyone has the luxury to stay safe, and some of our most valuable community members are the ones going to work every day and putting their lives at risk without commensurate safety precautions or compensation. In early 2019, I was mulling over the idea of microbes and social equity and thought it was a cool idea for a class. I pitched it to the University of Oregon Clark Honors College as a summer colloquium course and taught it in June-July of 2019. I had 15 undergrad students, only 2 of which were biology majors and the other 13 were humanities majors. In just 4 weeks, I taught them about relevant microbial ecology and examples where social policy or inequity could affect your microbial exposure and health. The students were really engaged and we had some awesome discussions. The culmination of that course was an essay co-written by myself and the students, as well as a few of the researchers who participated in the class and discussions, including University of Oregon Landscape Architecture graduate student Ellie Stapleton, Dr. Camille Chofi in Counseling Psychology and Human Services at UO, and Dr. Hannah Tavalier at the Institute of Ecology and Evolution at UO. It was peer-reviewed and accepted at PLOS Biology and included in the Microbiome Across Biological Systems special collection. This paper sets the framework, but I wanted to keep the discussion going. One of the next steps is to broaden the conversation because there are so many aspects of microbes and social equity that we could talk about. These are just a few of the ones that I came up with off the top of my head in making this presentation. And there are already people doing incredible research, design, and policy work that we can include in that broader conversation. The other next step is leveling the playing field and taking what we already know to start creating evidence-based policy and design. To that end, since January of 2020, I've been working on Microbes and Social Equity Part 2. I reached out to a number of researchers already involved in Part 1 or already involved in similar work, and there were a number of researchers who had reached out to me following the publication of this essay. We've met several times this year to discuss our work and where we'd like to take Part 2. This has boiled down to a special collection of invited papers and reviews in a scientific journal, and as that is still under development, I can't share more details yet. It also involves a symposium in conjunction with the University of Maine Medicine and the Rural Health Initiative here in Maine to present work and spark discussion, much like this meeting here today. There are a number of ways that you can get involved in promoting social equity in general and with respect to microbes. Most of these revolve around sharing information through open access publishing or social media outreach, as well as including diverse perspectives in design and planning. But it also involves using your social capital to advocate for things which benefit society as a whole, such as community gardens, and you can do this by participating in your local government and actually attending public discussions during city planning meetings. Thank you so much for coming on this little journey with me today, and please feel free to catch up with me on social media and follow up with any other questions. Thanks, bye.